Good morning, everyone. I'm Jessica Lovell, in for Dr. Steve Stites, our Chief Medical Officer today, who has taken some much-needed time off. We are coming from you live here inside the Dolph C. Simons Jr. Family Broadcast Studio. So glad you are with us. And also with us in studio today is psychologist Dr. Ashley Rhodes, who works with bariatric and other patients here at the health system. Also joining us inside Studio B is bariatric surgeon Dr. Jennifer Mcallister. Both doctors are here this morning to help us better understand what the CDC considers obesity and how it increases our risk of severe illness during COVID-19. And a recent report says that this pandemic is putting some people at risk for life-threatening eating disorders. So we're going to dive deeper into that here in just a few moments. But first, of course, Dr. Dana Hawkinson, our Medical Director of Infection Prevention and Control, updating us with the numbers. Over the weekend, you said not good. Any changes overnight?
Yeah, certainly we have less patients in than we did yesterday. So I think, again, the important thing to remember is really just as in cases in that 14, 10, 7-day rolling average, same thing with our hospitalized patients, which will be fluctuating and very variable through 7 days or 10 days. So we had 31 or 30 yesterday. We have 28 in the hospital today, 10 are in the ICU, and 4 of those are on the ventilator. We still do have 22 patients that are in the hospital but are in that recovery status, so we aren't counting them as towards our PPE or anything like that. And then in Hays, there are 17 active infections there, with 1 patient intubated as well.
All right, thanks for that update. I guess he deserves a seat at the table today?
He does, you know. And
well-deserved?
Well-deserved,
I think so. Good. You watched the game last night?
Yes.
Yes, I figured you were watching that. Okay, so Dr. McAllaster, good morning to you. So glad you're joining us. We're going to start with you today. So the CDC defines obesity as a body mass index of BMI of 30 or above. So that's really hard to understand. Can you help us understand exactly what that means? Is that 20 pounds or more? I mean, I think when we think of obesity, we think we have maybe a different image in our head, but help us break those numbers down.
Yes, so it's difficult when you hear those kind of numbers because we're all used to just seeing the numbers that are on the scale. But in order to talk about obesity and define it, we have to take someone's weight into consideration as well as their height. And so that's what the BMI is, or body mass index. So it basically defines someone's weight in relationship to their height. And so you're correct. The CDC defines that obesity is a BMI above 30. Overweight is a BMI above 25. And so it's difficult to say for someone how many pounds because you have to consider their weight. In general, it's around 75 to 100 pounds overweight. But again, it changes with height. And the great thing about technology is you can Google BMI calculator and put in your height and weight and easily see where you're at currently.
Oh, don't worry, I did. I was a little surprised myself. So then where does the percentage of body fat work into that equation?
You know, that's a difficult thing, and it requires a little more advanced technology. So you can't necessarily Google that one. You know, BMI, it's not a perfect indicator because certainly very muscular people may lean towards a higher BMI even though they're very healthy. So that takes a little more advanced technology to determine body fat, different measurements. There's different technology to evaluate body fat as part of weight as well.
All right, thanks for clearing that up. So Dr. Rhodes, how are you this morning?
I'm doing well, thank you.
Good to see you. Okay, so we talk about kind of mind over weight over food. I have to tell you, like, it's kind of an ongoing joke in my house. We'll be having our morning coffee, and I'm already asking, what are we eating for dinner? It's like, why are you always talking about food? I was like, it's not about the food. Well, it kind of is about the food, but it's about what the food means at the end of the day. It's that comforting time at the end of the day where you're with your kids or your family. But there's a food tie-in. It seems like there's always a food tie-in. What do we have for the Chiefs game? What are we watching? What are we going to eat during the election, during the debates tonight? So why is that? Why does food just tie us all together?
It's a great question. You're exactly right. Food is everywhere. It is a part of our lives. It is involved with how we celebrate, how we cope with things, you know, all types of events. And so when people are finding themselves turning to food right now, I think it is important to look at what is going on there. Our lives are completely turned upside down right now in the midst of this pandemic. for so many people. Their daily routines are completely changed. They have so much significant stress, and we've been dealing with this for 6 months now. So there's a chronic stress element here. So you're right, it's not always just about the food itself. So I think what people are looking for more than the food itself is some type of relief from the stress that they're experiencing, and also something that we can control in our lives when there is so much uncertainty and so much out of our control in the midst of this pandemic.
Yeah, and those good carby foods kind of are a good stand-in, right, when we're feeling that way.
They can be, absolutely.
Sure. But they can also lead to eating disorders right now. So are you seeing new eating disorders, anything different on, when it comes to that? Or are you seeing people who maybe already had eating disorders having kind of more episodes, more severe?
Sure, it's a great question. There was a recent study that came out that was looking at patients who had already been diagnosed with eating disorders. And by that, we're looking at a range between anorexia, bulimia, and binge eating, which is actually the most common one in the U.S. population. And for those people, they were reporting that they were having more symptoms, more episodes of their eating disorder behavior. And that's not even capturing all of the people who may have trouble with eating, but may not reach that clinical threshold for a diagnosis. But it still might be unhelpful eating patterns that could be getting in the way for them.
Well, that's what I was thinking, and that's why I wanted to ask Dr. McAllaster. So when is that, we talk about, I put on, during this pandemic, 15, 20, 30 pounds. It doesn't sound like a lot, but how unhealthy can that be, putting that weight on in a quick amount of time, and unhealthy eating habits?
Well, you're right. It all adds up. But I think one of the difficult things with obesity is patients look at that number, that 20 and 30 pound weight gain, and in their minds they think, I have to lose that entire 30 pounds. Well, the key thing is that studies have shown is even a 5% weight loss results in significant benefits in health. So for a 200 pound patient, losing 10 pounds results in significant health benefits. And so I think it's more important to look at little goals and getting back to health.
So what does that weight, though, actually do to our bodies when we put on that extra pound? What's actually happening in our bodies? Why are we so unhealthy?
It's fascinating to know all the things that obesity can cause in our body and those extra fat cells. And what we know is that obesity increases the risk of a multitude of diseases, diabetes, heart disease, problems with breathing and respiratory problems. It even increases the risk of multiple cancers, and it's now the leading cause of liver disease in the United States. And we don't know all the factors that can lead to all those various diseases. We do know that carrying that extra weight and extra fat cells is an inflammatory state. It can decrease our immunity. So, of course, the body is extremely complex, and we really don't know all the intricate factors, but certainly it's a risk for multiple diseases.
Okay, I have a lot of questions, but again, like usual, but I want to get to some of our questions from our media. Do we have any reporters on the line? All right, Jill, do you have some questions from the public this morning?
Yeah, Terry wants to know, is it okay to bake holiday goods and share it with our friends and family and neighbors like so many of us done in the past year during COVID?
Yeah.
I'll start with you, and then I'll jump over to you, because it does the soul good.
Yeah, I think compared to if we talk about the grocery store, when we were really being vigilant and trying to wipe down our grocery items, things of that nature. I think the same thing holds true for if you're baking them at home and delivering them or dropping off. I don't really see a big risk there. Certainly, if you are going to be doing that, you want to do good hand hygiene before and afterward. If you're receiving those baked goods or whatever, obviously do good hand hygiene before you're eating, but I don't see a lot of risk there. You're not having a lot of interaction with another person, especially if you're just dropping off those baked goods.
Somebody dropped off a chocolate cake last night, and I did not turn that down.
It's gone, right?
It is gone, I'm sorry. So that is right, though. When we talk about something, we want to give the love, share the love. Baking really hits home for a lot of people. Talk to us a little bit about that, and that again, back to the connection of food, and as we certainly descend on the holidays and the weight that it can put on.
Absolutely. So it is another great example of food showing up in every aspect of our life and the way that we celebrate, oftentimes very tied to the holidays. And I think that, if the risk is lower, people have some options there, right? But really think about what are people trying to do with that food and sharing it with other people. It's so natural to want to have that connection with others, with friends and family, especially since we've been deprived of that a lot of the times over these last 6 months. People have not been able to connect with loved ones in the ways that they typically do. So I think that compulsion or just that desire to share with others is very, very natural. But maybe look at other ways that you can still connect with people. I know that people have gotten really creative about how they connect with others in the midst of this pandemic, using virtual means, but are there some other ways that you can still hold that connection, keep some of those traditions, but also feel safe as we're moving into the holidays?
But chocolate cake is a good connection, I will say.
Absolutely.
I felt really good last night. So, all right, Jill, next question.
Yeah, Tanya, kind of going on with that last question. She says we are entering the holiday eating season. It's like a slippery slope all the way down to January 1. What do you recommend to your patients?
Sure, that's a great question. I think that really looking at the function that food is holding for people is really important. That's what I talk to my patients about a lot of the times. Especially when you're going to be around food more, think about what are you looking for in that? Is it that connection? How can you find that elsewhere? Or is there a way of modifying whether it's the amount of food that you have, maybe the frequency that you're eating those foods that are maybe tied to the holidays, or just some other ways that you can still engage with people. And just be really mindful of that process as you're going through that. So those are some of the things that I talk to my patients about to help curb that, but still have that celebration and enjoyment with other people.
Dr. McAllaster, your thoughts on that?
Yes, so certainly I'm a bariatric surgeon or a weight loss surgeon, and so this is something that we always discuss with patients, is that how do you, after surgery, transition back to your normal life, and then how do you change normal life so it doesn't lead to weight gain? And still, you can interact with friends and things that are focused around food. But especially for our patients, the key is learning what's the healthy way to approach that food. And so sometimes it's out of sight, out of mind. If someone knows that having that food around is their trigger, then they do best if that food just isn't there. But also, certainly, we discuss with patients that, it's okay to have those kind of foods, but it needs to be a not everyday thing, every once in a while, and they need to get their healthy foods in first before they have that kind of thing. So it really changes kind of the approach to how they're eating, and it really takes everyone knowing what their own personal maybe weak spots or where they fall into problems with food.
And Dr. McAllaster, how has COVID affected some of your patients?
It's interesting. It's really brought a light into, we know stress plays a role with weight gain and obesity, but it's really brought into the limelight how social interactions affect our activity. So certainly when all of the gyms were closed, that was a huge barrier for not only our patients, but for all individuals looking to improve their health. Something that oftentimes is not focused upon is just our normal activities. So we call it our non-exercise activities, or how we burn calories. And so that's things that we do in everyday life. So standing rather than sitting, walking to work rather than taking a shuttle, all those little things that you can do throughout the day. And what we found is that when those big bursts of exercise that were done at the gym is taking away, then yes, a lot of people realize that their normal day-to-day activity could improve. They could do more during those restful times. And the great thing that most patients have realized is that they can multitask. Certainly multiple people who are working from home, they can stand at their desk while they're doing work. They can do extra activities like doing the laundry, cleaning the house. Those kind of things all add up throughout the day. And so really it's just being creative and figuring out how in your normal day can you get that extra activity. It doesn't have to be something that all adds up at the end of the day and takes 30 minutes to an hour.
Yeah, those little things matter. Jill?
We have a couple of surgery-related questions. Susan wants to know, does surgically assisting someone in weight loss truly help their health?
Dr. McAllaster?
Yes. So, what patients need to know is that bariatric operations or weight loss surgeries are just a tool. They're not a cure. And so the operation in itself is not going to cure someone's obesity. It's a tool, so it plays a role, but patients also have to make those food choice changes and lifestyle changes. But what we know is that when patients reach that level of severe obesity where they're 100 pounds overweight, the body, it's very difficult for patients to lose that weight without extra means, meaning surgery. So only about 3 to 5% will be successful with diet and weight loss. The body tries very hard to maintain those extra stores. And so surgery is an excellent treatment. It's highly successful, but it takes those other things as well. And certainly it takes the role that Dr. Rhodes plays in really helping patients realize what their relationship to food is.
Talk to us a little bit about that, how you're helping these people kind of getting their minds caught up with their bodies.
Absolutely. That terminology is something I talk to patients about a lot, and that you have this rapid change in your physicality and the weight loss itself, but your mind takes a lot longer to catch up to that. So something like body image, how people see themselves, that is more than just their physical appearance. It involves how they think about themselves, how they feel about themselves. And as Dr. McAllaster is saying, we're asking people to make all of these changes in their lifestyles of how they eat, what they eat, activity. No one gives you a rule book for how to fit that into your day-to-day life. So my role is working with people, getting to know them, getting to know their day-to-day, and then helping them find some practical strategies and tools that can help them build in those lifestyle changes in ways that feel sustainable so that they can have that long-term success with the surgery.
So this is from Abra, and it's a little bit long, but I'm going to read it because it's so powerful. Abra writes, how do I go about getting information? I am 41 BMI and had gastric sleeve 6 years ago, but had some issues. My doctor wants me to have this done the new way, so we may want to clarify what that is. I have not gained back any weight, but I'm stuck at 320 pounds, and I just need help. This is all so scary, and I am trying so hard. Please, if you can help me, I would appreciate. God bless your kindness, and words are powerful. I learned a few triggers. Thank you. So how can we help Abra?
So, Dr. McAllaster, I'll have you comment on that first.
Yes. So first of all, I think it's important for Abra to know that she's not alone. And weight gain and inadequate weight loss do happen. And all of our bodies are different, and not everyone responds to that treatment. And so we need to look at these surgeries not as though it's a one opportunity. There are multiple things, including different behavioral modifications, dietary modifications, even different medications that can help with ongoing weight loss. When we talk about having a bariatric operation and then not achieving the weight loss and the health goals that we would like, there are options for revisional procedures. All of these operations change the body somewhat, but all in different ways. And so patients sometimes will have an operation, and when they don't have those significant results that we hope for and that we're trying to achieve, then those operations are a potential. And so certainly it's something that reaching out for your physician to help and discussing next steps is absolutely important. And you should be celebrated for reaching out and doing that. That's one thing I think patients take it so hard that they feel like they failed. But what we know is this isn't a cure, and they may need additional treatments in order to achieve their overall health goals.
Dr. Rhodes, do you have some advice for Abra?
Sure. Well, thanks, Abra, first of all, for sharing that story. As Dr. McAllaster mentioned, just really highlighting the fact that this is something that a lot of people do experience and that she is not alone there. I think another thing to potentially focus on is just that distinction between weight and then health-related goals and non-weight ways that people can still be achieving success with surgery. It is often very easy for patients to become very honed in on that weight itself after surgery. But are there other things about Abra's health and kind of those original motivations for surgery that have improved that she can also focus on as a foundation for continuing with some of these health behavior changes in addition to reaching out to her doctors and seeing what those next steps medically could be?
Dr. Hawkinson, I know we were talking yesterday about just you see COVID patients. Are you seeing a lot of patients that are obese, and what part has that been playing, and what kind of conversations, I guess, are you having with them? Yeah,
just anecdotally in my own experience, I've seen a range of non-obese and obese patients. I think in general, in our health system, as probably around in many communities, we do have a large obese population. So we see patients in the hospital not only that are non-obese, but we do see a lot of patients that are obese as well for various reasons. And Dr. McAllaster can talk to this, and she alluded to this earlier. It does affect your other health, so heart health, cardiology, cardiovascular health. It can affect your immune system. It is a semi-inflammatory state, so your immune system doesn't work well. It can increase the risk of diabetes, and we know diabetes can affect all the organs of the body. So overall, yeah, we do see patients in general in the hospital that are obese. A large proportion of them are obese, and it's not only for COVID, but it's for various things.
Sure. I think we have a reporter on the line. Media question?
Yes, good morning, guys. This is Taylor at Channel 41.
Hey.
Hi, Taylor.
I appreciate you letting me get my question in this morning. We have obviously a lot of parents in the Shawnee Mission School District that we're getting ready to send parents or send students back next week to the hybrid model in person. Shawnee Mission sent out a note yesterday saying they were going to be sending thermometers home and daily logs, like assessments they need to have their children take every morning before school on COVID-19, symptoms to watch for, that kind of thing. Is that effective in stopping the spread, or is that something just for a peace of mind situation? How effective is that temperature and daily assessment kind of thing if you're sending your kids back to school? Thank you.
Yeah, I think it's kind of both. I think it certainly is an adjunct. It's one more step to help prevent an ill child from going to school. We know that the children may not have any symptoms at all. But we also know that not every child that has symptoms will have a fever. They could have other symptoms as well. So it is one more step. Certainly we do recommend when our employees are exposed to COVID patients or in a contact, we do recommend that they do self-checks every day with temperature and things of that nature, symptom checks. This is one more adjunct to hopefully prevent an ill child from going to school. I don't see any harm of doing it at home. If you can do it before you go to school and when you get home, things of that nature. It's just one more step to help try and protect the children around that child at school, but also the adults in that school as well.
Well, it's hard because how do you know when your kid's sick? I mean, they can have the crud, they can have a little bit of a runny nose.
Yep.
Normally, you might send them with a box of Kleenex, and as long as they don't have a fever. But I mean, gosh, it just seems like, what do you do?
And so, yeah, again, fever. In that young population, it may not be certainly every child. Is it 75%? Is it 50% of children who are sick present with a fever? It's hard to tell. But some people may not have a fever. But again, it's just one more step to help try and prevent the spread of the disease within the school system.
Yeah, I heard Taylor talking about that this morning, having the parents take the temperatures and handing out thermometers to everybody, I thought.
Yeah.
Okay, that's one way of getting around it. So we'll see. Jill?
Donna wants to know, what is binge eating exactly?
Ooh, that's a good one. I'll let you start with that one, Dr. Rhodes.
I can do that. So binge eating is when people are eating, say, like 2 or 3 meals worth of food in one sitting, so within a relatively short period of time, and then also experiencing this feeling where they're out of control with eating. So it's not simply the food, the quantity itself, but it's also that person's experience with eating. And if you're feeling that sense of feeling out of control, that is where we're getting into that binge eating territory with all of that combined. And then patients often, if they have this experience, will then try to compensate. Either they could compensate through throwing up, through using laxatives, diuretics, or for going long periods of time without eating. Those don't always happen, but they can occur for patients as well, which can get into just a very unhealthy eating cycle overall.
Jill?
Jonna, on that point, wants to know, what do you think about the fasting diets where you fast for a period of time and then eat?
It's a great question. I think that from my perspective, I work mostly with bariatric surgery patients, and in that case, it's really important for those patients to be eating regularly. Their stomach is so much smaller that there's just such a tiny amount of food that can fit in there, so we really need to eat regularly in order for people to get what they need in order to stay nourished. And then also stay hydrated on top of that, very important. So from that perspective, those types of diets would not be recommended for that patient population. Obviously in the general population, sometimes people really feel like that works for them. And so it's not a one-size-fits-all approach, but definitely for our particular patient population, we try to avoid that as much as possible.
And I would like to say, too, please correct me, and Dr. McAllaster, correct me. I think there was also a recent study that actually looked at also intermittent fasting versus smaller meals throughout the day, and they didn't really find any significant difference within those populations. So I think it matters about the total calorie intake and, of course, the output. How much calories are you burning in general? So, but just as you said, not one size fits all. It is very individualized in what works best for you.
Dr. McAllaster, what do you tell your patients?
Well, yes, certainly dealing with patients after bariatric surgery, it's a different anatomy than the general population, so they have different guidelines. I think the key with all of those things and any diet, because everyone's body is different and will respond differently to different attempts. Unfortunately, we don't know those things that trigger a different response to different diets yet. Hopefully we will someday. The key, though, I think, is just keeping track of things, not in an obsessive way, but keeping track. And when you focus on a certain diet, you're paying attention to what goes in your mouth and how much activity you're spending. So like Dr. Hawkinson said, those are the important things. And not only how much you're eating, but what you're eating and healthy food options. And those are the things that we focus more on.
And Dr. McAllaster, are your patients holding off on getting the surgery due to COVID? I mean, you had told me yesterday, you said this is really no longer considered an elective surgery. This is really quite vital. So are you encouraging people to move forward with their plan of getting bariatric surgery, or is there some concerns from patients?
No, certainly we know now how to operate in a safe manner during the COVID pandemic. And what we had discussed, that when we say an elective procedure, it means something that maybe isn't immediately pressing as a health concern or risk. Well, what we know, though, with obesity is that it's a significant risk factor for all those diseases we've mentioned previously. But now we also know that it's an increased risk factor as far as severity of disease in those who do contract a COVID infection. So it's an important risk reducer. It's important for overall health. And so certainly I think patients realize that. And yes, we know how to take care of patients safely during this time period. And it's something that we are encouraging patients as well.
Sarah wants to know, it's a nutritional question. She wants to know if there's any benefit to the energy gel packets or gel chews that you can do while you're exercising. She said she read the label and they're mostly sugar. She wanted to know if you were familiar, what you think.
Have you heard of that, Dr. Rhodes? I have not heard of that.
You know, I haven't heard of that exact gel that she's talking about. I'm not sure if Dr. McAllaster maybe has had more information there. But in general, things that are going to be higher in carbs or sugar, you're going to be more likely to set yourself up for that crash afterwards, and then potentially your body craving that additional carb or sugar later. So that's where that cycle could come in for folks, and noticing energy levels related to that. But I'm curious if Dr. McAllaster has other information about those gels specifically.
Yeah, is it something you take while you're exercising to like boost?
Yes, so there are a multitude of supplements to increase your capacity during exercise. Certainly for our bariatric population, those are highly concentrated sugar preparations. And so as Dr. Rhodes mentioned, in everyone, but especially in the bariatric patients, that's going to lead to kind of a drop or a crash after eating those. Those kind of supplements really are probably more suited for extreme levels of exercise. So people who are training for marathons and that kind of level. But for the average American who's doing a great job of going to the gym and trying to improve their health and get in shape, those supplements aren't necessary, and they're really probably not healthy nor needed.
Probably just continue your hydration and water intake, I would think.
Yeah.
Jonna says, my husband gets hangry. Is that a real thing?
I say yes, and I'm not a doctor. What do you say?
I think that we can all relate to that feeling of having not eaten for a while, maybe getting a little bit more irritable. I think the term hangry has come out to describe that rather accurately. And in those cases, I would encourage people to really look at, what is your eating pattern? Are there large periods of time that you're going without any kind of food intake? And see if there's anything in there that you'd like to modify to maybe prevent the hangry.
Right. Well, you have headaches and you don't feel well. You've experienced it, I'm sure. You're
All
not
the
chipper
time.
all the time.
All the time.
That's not true. He is lovely every second.
I said, how could it be, right?
You're right. Ask my kids. All right.
Dr. McAllaster, hangry, is that a thing?
Well, yes, certainly it's interesting how the sensation of hunger is expressed differently in everyone. And I think the key thing is that when you're evaluating your own hunger or your spouse's hangriness, is not to look at the quick fix of, hey, go eat something, go eat that cookie. The more important thing would be to say, okay, what all have you done throughout the day today? What did you have as your last meal? Was it simple carbohydrates and now you're experiencing that crash? I think the important thing would be to evaluate what they're doing in life that leads to that level and then figure out a healthy approach to try to avoid it, both for the husband and the wife.
Dr. Rhodes, you had a follow-up to that?
Well, going along with what Dr. McAllaster is saying, another thing that I talk with patients about is really noticing a difference between that physical hunger, but then also what some people call kind of a head hunger or mental hunger. And I think that ties back in with that discussion of the stress eating or emotional eating, because sometimes those things can be triggering folks to go towards food when it might not actually be the food itself that they're looking for in those cases.
But how much does hydration play in that? I would imagine that's a big part. I always think, I have a headache. Is it the water? Have I drank enough water today?
Absolutely. Hydration is going to be critical there, and so something I really encourage people to do, especially if it's one specific behavior that they're trying to target, whether it's hydration, whether it's trying to eat more fruits and vegetables, higher protein, is to keep track. Not forever and ever, but maybe for a day, for a week, see what that baseline is for you right now, and then really monitor that specific behavior, monitor that hydration, set some really specific goals. Those are the two best things that we have to make that more effective when folks are looking to do a little bit better or increase the behavior there.
That was a good question. Jill?
Yeah, Karen and Dilsa and Marty, they've all got questions that are kind of the same, but it's around what do you recommend as a serving size and what should a small meal be composed of? They're talking about the food pyramid. And I'm just curious to add to that, with your bariatric patients, if you can only eat a small amount, do I eat all protein in one setting and then all carbs in my next? I mean, how do you do that?
Dr. McAllaster, we'll have you get started on that.
Yeah, so absolutely. With our patients, this is a very important discussion so that they know what are the appropriate proportions and in what order do you eat those. And so we often talk with our patients about a perfect plate. So not using the large dinner plates that everyone's used to, but using the smaller 6 to 7 inch salad plates instead. If you divide that in half, then half of that plate should be protein. So about the size of your fist is about 3 to 4 ounces, and that should be protein. After that, that other half of the plate, you can divide that in half. And so in the 1/4, that's where your non-carbohydrate vegetables go. And then finally, it's those starchy vegetables or any sweets or desserts. And we recommend that you eat in that order so that you get your protein first and you're getting those other healthy fresh fruits and vegetables. And then after that, only having the other foods if you're still hungry. Not if you're not full, but if you're still hungry. And that is what we think is the best approach for our post-surgical patients.
Dr. Rhodes, that sounds hard to do. And not just for bariatric patients, for all of us, right?
Absolutely. It is something that is difficult to adjust and modify our eating habits, and especially if people take inventory of just what are their eating habits like right now? What is your baseline? For so many of us, it can be natural and normal to get into the habit of getting that larger plate, right? Filling that up. And there is something psychologically about seeing a full plate. So as Dr. McAllaster was mentioning, if you can still have a full plate, but if it's smaller, you can still have that sense of satisfaction with eating, especially for our bariatric surgery folks where their anatomy has been changed to only allow for that small amount. But I think it's something that can extend to the general population as well. Just being mindful of what are your current habits and are there small ways that you can modify those or change those to improve your health.
And I think to that point, just like with the non-pharmaceutical interventions with social distancing, physical distancing, masking, and frequent hand hygiene, it does take a little bit of work. But if you start doing it for 2 or 3 or 4 days, it becomes natural, it becomes second nature. I think this is part of that. It probably takes longer than 2 or 3 or 4 days. But if you put a conscious effort into doing that and understanding how much food you want to eat and which kind of foods, after a while it probably will become second nature.
Way to work in your masking message.
Yeah, right.
That was
Continue.
really good. Nice work.
It's always there.
It's always about the
there.
masking. Jill?
Catherine wants to know, in general, at what BMI is bariatric surgery recommended?
Dr. McAllaster?
Yes, so bariatric surgery is a very successful tool to treat obesity, but it's not the right tool for everyone. So in general, the guidelines for bariatric surgery and who qualifies would be a patient whose BMI is above 40, or a patient whose BMI is above 35, but also already has those diseases related to obesity that we mentioned before. So diabetes, high blood pressure, high cholesterol, or obstructive sleep apnea. Those are the general guidelines of patients who qualify for bariatric or weight loss operations.
Jill?
All right. Susan wants to know, does sleep apnea affect your weight? And how?
Dr. Rhodes?
Yes, I think Dr. McAllaster is probably going to be our best. The answer is yes, but Dr. McAllaster might just have a better way of explaining that to folks. Sleep apnea is definitely important in this process. Yes.
Yes, absolutely. Obstructive sleep apnea significantly increases the risk of weight gain. And that's a tricky one. It's a little bit of a chicken and an egg. What we know is as we gain weight, you increase the tissue in your oropharynx, and at night, you basically aren't getting restful sleep. That does lead to ongoing weight gain in multiple patients. So not only is extra weight or obesity a risk factor for sleep apnea, but then it compounds the problem because sleep apnea then makes ongoing issues with weight and additional weight gain. So certainly if anyone has concerns, or if someone's told you that you snore a lot, seeking out your primary care provider is the important first step to evaluate for that. What we know is restful sleep and is an important part of wellness and successful weight loss.
Yes, and the only thing that I would add to that is that oftentimes patients do have difficulty with wearing, like a CPAP mask, for example, and that is something that they can have help for. That's something that I work with patients on, actually, is if there's anxiety about wearing a mask while you're sleeping, which can often be the case for folks, there are treatments for that. So I encourage them to reach out to their providers if that's something that is a barrier for them for receiving that very important treatment.
Okay, Cindy wants to know, what are the doctor's thoughts on a snack after supper before bedtime? Does the timing and composition of the snack impact weight gain?
Dr. McAllaster?
I want to know because
yes.
I want sugar all the time.
Oh, right.
At
I
9,
know.
it's like, okay, I need sugar.
Yes. Unfortunately, late night snacking is not a healthy approach. Studies have shown that it's the late night eating that is even more problematic than calories that are consumed during the daytime.
Well, makes sense. We're not surprised by it. We were hoping for a different answer, but we can't escape it, right?
We cannot. No, I think that's one of those patterns that people can just get into. You know, it can become a norm. Sometimes it's after you put the kids to bed and that's time with the spouse or time for yourself to maybe relax, unwind. So it makes sense. You know, we can see why people might be turning to foods. But something that I talk with patients about a lot is, okay, what's modifiable? What can you change about this process? Can you change the type of the foods that you're going for so this can be a little bit healthier? Can you decrease the amount of times maybe throughout the week that you're doing this as a first step? Or really truly finding other ways for yourself to have that same relaxation, that de-stressing that doesn't involve food. Those are some quick strategies that folks can build on as well.
Did you get all that, Jill? I think
yes.
you're cut off. Last question.
She said not a good idea. And I just tuned out.
And you tuned out. I know.
Right.
But, all right, last question.
Joyce has got kind of an interesting one. It's kind of a history thing. She said BMI was introduced, she believes, in the 19th century by a Belgian mathematician, and the goal was to assess obesity in the general population. But she wants to know, is it really a good indicator of fatness? Is the word that she uses. Or would pounds be better?
Dr. McAllaster, that's all you.
Oh, yeah, it's an excellent question because we have to have a way to take into account everyone's height with their weight. But no, BMI is not a perfect indicator of fat mass nor muscle mass. It's a good general means to establish that and look at weight, but it's not the best.
I know yesterday we were talking about BMI,
Yeah.
and you told me, and I said, no, I think you're wrong.
Right.
I think you're right. Sorry, I questioned you, but it just doesn't seem to
It
add
happens.
up. But it certainly
No, I
does.
think to Dr. McAllister's point, it's not the perfect thing. It's a general. There are other ways, and especially if you want to look at your body fat composition, there's other ways to do it. This is a general way to do that, the BMI, the body mass, and it's been used for a long time, and it can be used in different things, and it's an easy calculation, but it's not the best way. So
All right, gives us a
it's
good
just
idea.
a general.
There's
Yeah.
just one real quick one, and I don't know if the doctors know this, but we have people asking if bariatric surgery is considered an elective if insurance covers.
Dr. McAllaster, do you know that?
Oh, yes, absolutely. So most insurance companies do cover bariatric surgery, and they all have slightly different criteria, but in general, what I spoke to previously, so a BMI above 40 or a BMI above 35 with diseases or comorbidities of the disease. Unfortunately, some insurances do not cover it, which is frustrating, even though we know it's a successful tool and a safe tool. As we discussed, as far as elective goes, that's something that goes into the time period of which you perform a procedure. But again, I think we realize now with the epidemic of obesity and the increased risk that it poses to our day-to-day health and the increased risk in relation to COVID, I think we need to revisit that of what we consider elective. But yes, most insurances do not cover. Oftentimes then for patients that have insurance that don't cover it, there's other ways to finance that that are make it more reasonable or accessible to patients.
Good questions today. I learned a lot. You know when I learn a lot, that the questions are really good. So I want to get our final thoughts from our doctors. First, thank you to both of you for coming on. Dr. McAllaster, just some final thoughts today as we head out. What do you want us to know?
Yeah, well, I think the important thing in a pandemic when we feel like we don't have control over anything is looking at the little things that we can. And so really making a mindful decision to have healthier food options in the house and looking at ways to increase your normal day-to-day activity. That's what is going to add up. It helps with mood, it helps with weight control, and doing that for your family or doing that for your friends, getting that social aspect involved with that is important. So it's something that right now we can take control of and try to improve health.
Thanks for that. Dr. Rhodes, I want to get your final thoughts, but I also want to say, Logan, can you put up the National Eating Disorder Association graphic that we had? We talked about that today, and I just want to make sure people have access to that. Tell people a little bit about that and when they could utilize it.
Sure. So the study that we referenced a little bit earlier showed that calls to this hotline, the National Eating Disorders Association, their helpline as well as their chat and texting services have increased significantly in the midst of the pandemic, which I think is a reflection of just the amount of stress that people are under, and that also if they already had some of these struggles with their eating behaviors, that can increase in the midst of additional stress like the pandemic has brought on.
A lot of great information today. What are your final thoughts? What can we leave here? What's our nugget of information that we really want to walk away with?
Sure. So first of all, absolutely everything that Dr. McAllaster is saying, the small ways that you can have that control. On top of that, at a broader level, we are all dealing with so much stress. I'm talking to people a lot about how the strategies and tools that worked for them maybe pre-COVID might not be the strategies that are working best for them at this point. And no one gives you a rule book or a guideline of how to handle stress in the midst of this or how to change your entire lifestyle to manage additional demands. So, first of all, please try to be as graceful, non-judgmental with yourself in this process. That doesn't come easily, but notice that this is something that we are experiencing together. And if you can find some additional ways to deal with that stress and make some of those small changes, that can really, really go a long way for folks.
Great advice today. Thanks so much for coming on. Dr. Hawkinson?
Yeah, to your point, everybody is dealing with stress, and we've been dealing with this especially since March with the pandemic, on top of all the other stress we were all dealing with on a regular basis. But it does take that initiative and that active change to be doing these things. Most people have learned to wear masks and to physical distance and to do hand hygiene. The other components of your lifestyle, such as eating and exercising, that is another component that we have to be looking at, and it takes an active change. And once you start doing that, 1 or 2 weeks, it will become second nature and you'll be able to do it more. It is getting cooler now, so you will be able to be walking outside, so certainly try and get in your activity as well.
All right, thanks to all of our guests today. Okay, so coming up tomorrow, have you heard of the Keep Wyco Well initiative? Well, it includes a pledge that anyone can take that promises to follow the pillars of infection prevention and control in order to keep businesses open and people healthy. So tomorrow, Daniel Silva with the KCK Chamber, Marcia Harrington with the Wyandotte Economic Development Council, and Alan Carr with the KCK Convention and Visitors Bureau will join us to update all of us on how that is working and how you can get involved. So that is tomorrow. Of course, we want to, as always, show you our masking photos. People have sent those in, so remember to send those to us at Medical News Network at kumc.edu. This is Becky. I think she's still on her Chiefs high from last night. She sent this in super early this morning, so she's got kind of a collection of Chiefs masks like I think a lot of people are getting. So thanks for sending that in, Becky. Thanks for staying safe out there in the community. And then check out this little guy. You may remember him. This is Jamie. We showed him earlier this year, but we can see him all the time. Look at him cheering on Mahomes. So thanks, little guy, for sending that in and keeping us safe. So we wanted to share that again. Also, we wanted to share again that PSA that we showed yesterday, courtesy of the Royals. Come back, KC. And of course, Dr. Dana Hawkinson, you're always getting in there somehow. So this is all to remind all of us to get our flu shots.
I'm like COVID.
What's that?
I'm like COVID. I'm just always getting in.
You are not going away.
Nope.
You are not going away anytime soon. Okay, so this is, again, our push for everyone to get your flu shots. It is so, so important. So be safe. We'll see you tomorrow, and check out this PSA.
It's time to get your flu shot. Put on your game face, gear up, protect yourself and your community against the flu.
This year, more than ever, getting a flu shot matters.
Protect yourself, your family, and your community.
Flu season will be here fast. The best time to get your flu shot is now. Getting a flu shot will not protect you from COVID-19.
But people who get the flu may be more susceptible to a severe case of COVID-19.
By getting your flu shot, you can ease the burden on our labs, our hospitals, and our healthcare workers. And a flu shot means you reduce your risk for symptoms, severe illness, and being hospitalized.
Get your flu shot and maintain the pillars of infection prevention to stop the spread of flu and COVID-19. Wear a mask, maintain social distancing, and wash your hands frequently.
You heard the doc. Do your part. Let's go, Royals fans. Get your flu shot.